Amidst rising demand for mental health care services on campuses across this country, Canadian universities are grappling with how best to serve students in need of support. With us now on how to move from increasing awareness of the issues to making progress on getting students help, we welcome in Kingston, Heather Stewart, Bell Canada Mental Health and Anti-Stigma Research Chair and Professor of Public Health Sciences at Queen's University. And in our studio here in Toronto, Franco Vaccarino, President and Vice Chancellor of the University of Guelph and a Director on the Board of Universities Canada, and Stephanie Bertolo, Vice President for Education at the McMaster Students' Union and a member of the Ontario Undergraduate Student Alliance Steering Committee. Delighted to welcome you two here in our studio in the Big Smoke, and to our friend Heather Stewart at Queen's University. We're happy you could join us as well. This discussion here tonight takes place as the Canadian University Boards Association meets at, Dr. Stewart, your university at Queen's in Kingston. So this and other things will be a much discussed subject of conversation there. I want to start, Heather Stewart, come on in this first, please. The demand for on-campus mental health services is apparently rising faster than the actual student population at many of our post-secondary institutions. Why do you think this is the case?
It's hard to say why it's the case. It's certainly been confirmed, though, from our wellness people when we talk to the people who run the services. They're having a hard time keeping up. I think maybe part of the issue would be that as people become more aware and as we're more willing to talk about it, the stigma has decreased a bit. They're more likely to come forward for care. And so, you know, the success of stigma reduction is the failure of the service system. We're putting so much pressure on the services, they can't really keep up. So that's probably one reason, is that students are much more willing to come forward these days than they would have been, say, 10 or 15 years ago.
President Vaccarino, what do you see?
I think that that's right. I mean, it's pretty clear that the anti-stigma campaigns have been working. If you think back 10, 15 years ago, what you see today is people coming out of the shadows, quite frankly, and more comfortable coming out of the shadows, and that means more pressure on our services. I do think there is also the question of whether or not the environmental changes over the last 15, 20 years associated with increased pace of change, more disruption, whether that's feeding into some of this as well. But I think really the big factor is coming out of the shadows, comfort with coming forward, and also at the receiving end, I think people being more open and understanding and being able to identify these issues as they emerge.
Vice President Bertolo, you are the voice of students on this program tonight. What do you see?
I would agree that the stigma is definitely decreasing, which allows students to seek support as well. And we're seeing universities increase the amount of support they're offering, and a lot of students are becoming aware that they can access these resources, so they're more likely to seek them out. But at the same time, I do think that because of rising costs of tuition and an uncertain employment situation after graduation, students also face increased stress that may result in mental health challenges throughout their undergraduate career.
That contributes, eh? You hear students saying things like, I'm getting this education, but who knows if I'll ever get a job at the end of it? You think that contributes to it?
For sure, and I do think the cost of tuition also, when students don't know how they're able to pay their tuition and their housing costs and their cost of food, that can definitely contribute to increased stress and relate to a number of other challenges that students are facing in their academic life.
Heather Stewart, do you hear comments about, I'm in so much debt right now and it's just adding to my anxiety?
Yes, for sure. And the other thing is, because everything is so much more competitive, people are concerned about getting jobs. There's a lot more emphasis on marks in the minds of students, and they get very stressed out about their exams, their ability to keep up, their ability to juggle demands of different courses and, multiple exams in the same week. So there's certainly finances, but I also think the academic demands are perceived as being much more important now than they would have been when I went to university.
Let me follow up with Franco Vaccarino on that, because that's my sense of it. When you and I went to university, I mean, we wanted to do well, but we didn't think the world was coming to an end if we got a B. My sense of university students today is they feel this incredible pressure to do so well. Where's that coming from?
Well, I think part of it is just the sense of increased competitiveness out there. I think that the economic landscape has changed. I think the nature of jobs, if you look back 20, 25 years ago, the likelihood of, landing a job in an organization that was relatively stable and somewhat long-lasting was quite high. I think today there's a much more rapid turnover and the related uncertainty. So I think that does create more sense of competitiveness. I also think choices. There's a lot more choice now, and the upside of choice is just that, choice. But the other side of it is there's more uncertainty. Am I making the right choice? Am I taking the right direction? And how do I align that with career aspirations?
Stephanie, I should follow up with you on that, because in terms of courses, there is unprecedented choice. In terms of social partners, there is unprecedented choice. Social media has just made us swipe to the left or the right, or however the heck it works. Infinite choices in those things. Does that add to anxiety for students?
I definitely don't think it might be the biggest stress on students, the amount of choice that they have. I do think it's the uncertainty more so in terms of job opportunities afterwards. Are you going to get a well-paying job? Are you going to be able to pay off your student debt? And are you getting the skills that equip you in order to do that?
What kind of services are available on most campuses that you're aware of? If you're having a mental health challenge, what's available?
So all campuses have a student wellness center, as we call it at McMaster, which is an on-campus clinic where students can go and seek support that often have nutritionists, family doctors, psychologists, and maybe a psychiatrist that students can speak to. Which is very convenient for students because it's right on campus, which is a great support. And then we also have a number of peer support services operated by student unions where you can able to talk to your peers about how to, some of the challenges that you're facing and maybe also how to navigate systems within the university and in the surrounding community.
Heather Stewart, how about at Queens? What's on offer?
We definitely have that. We also are starting to think more about an ecological framework, thinking about how we can promote wellness in the most general sense of the term in every way in everything that we do, including our physical environment. Thinking about how to relieve some of the pressure on the treatment services by thinking about promotion and prevention. And there are some things that we can do that are justified in the literature, and we need to get a little more coordinated about how we do that. And I think the universities and post-secondary institutions across the country are probably all struggling with the same kinds of issues. Where do you get the funding when you're at your maximum capacity on treatment services to devote finances to promotion, prevention?
And Franco Vaccarino, how about at Guelph?
Yeah, I think similarly, and I think that the points have been raised are very important. I think increasingly it's really understood that an integrated approach needs to happen, and so we're, for example, rolling out a new delivery system this summer and the fall for student wellness services, and it's going to include health, counseling, accessibility, wellness education, et cetera. And the other piece is around navigation. It's not just about providing the support, but one of the things that we're finding is that young people, our students, are they may know that in general supports exist, but where to go, how to navigate, what choices to make, they may not be entirely sure which door they should be knocking on, at first step. And one of the things we're doing, we're introducing this new system of mental health navigators, if you will. So there's actually someone who helps triage, helps support the student in choosing and navigating through the system.
So if you're in trouble, you know who to call.
Exactly.
You know where to go.
Yeah. And developing a bit of a plan. First step, first phase, and subsequent phases, and so there's a broad context as opposed to just dealing with the acute situation.
Stephanie, in your view, if somebody was experiencing mental health challenges or anxiety on the McMaster University campus, would it be obvious and apparent as to where they should turn for help?
It depends, I think, on the student and how informed they are about the services offered. A lot of students may not know that they can go to the Student Wellness Center. It also may take a while to get an appointment and even subsequently get an appointment with the person that you should be having an appointment with. So I think it's you need to know where to go, where the entry point is, but then also be able to find the points afterwards of what you need. And I think that our professors and a lot of the student-facing staff can help students, guide them to these resources. If a student is struggling, they may not be as open about the fact that they need to go to a doctor and talk about that they're feeling depressed or they're feeling anxious. It might come out with asking a professor for an extension on their paper, or it might come out at a library when you're breaking down when you're in exam season. And I think a lot of these people can help in the system navigation piece and allowing students to access these services.
Go ahead.
I think this is a great point because, I mean, one of the issues is that students who come forward looking for help are already at a point where they're open, they're willing to, you know, to be proactive. But to your point, a very important one, Stephanie, that there are students who actually are not well. They may be going through periods, and that's an important distinction.
And therefore can't seek out
and
the help
therefore
themselves.
can't seek out or are not making that initial move. And so it's important also to distinguish between, you know, health promotion and how to support, you know, young people, students who are inclined to look for this work, but also to provide a context to help recognize when something a little bit more serious is happening, and be able to intervene and detect these things relatively early.
Okay, we're going to see if the memory works here. Sometimes it does, sometimes it doesn't. Charlotte Yates?
Yes.
At your university?
Yes.
Formerly at McMaster?
Correct.
She was on this program, I think, a couple of years ago,
Yes.
saying that even she goes to dormitories. What is she, the provost there or
She's
something like that?
Charlotte is our provost.
Okay.
Yeah.
She herself knocks on doors in the evenings to make sure that students are okay.
So that, you know, that's an example, and I participated as well in those programs. And it's very interesting. If you can imagine a student in their dorm room getting a knock on the door, and there's the provost or the president. But really, the aim of that, it wasn't a clinical intervention in that sense. But what it was aimed at doing is we care. We're thinking about how are things going, and it actually was very well received, and it was really a signal to the students that we're there and the supports are there. And actually there were a number of very specific rooms that we visited where in fact we were able to direct students to to particular pieces. And the other point is timing. I think timing is very important. We participated in that just before exam period, and it was an important point as well.
Heather Stewart, I want to bring you in on this issue, and it's going to follow up on something Stephanie said just a few moments ago. I always thought the job of universities was to educate, but given the amount of mental health challenges and anxiety that you're seeing on campus right now, you are in some respects a bit of a front line in that challenge. And I want to know whether or not you think universities are adequately resourced and funded and staffed to handle all this.
Well, the short answer is no, we're not adequately resourced or staffed. I don't think anybody really is to manage the swell of mental health issues. But, you know, so many students say that their mental health problems are interfering with their academic potential. I think that the mission of the university can only be met if we start to pay more attention to the mental health challenges that our students are facing. So we're going to have to think about new and resourceful ways of getting funding into the right places to take some of the demand off of the treatment services and to think of more upstream solutions like promotion, prevention. Otherwise, we're just not going to be able to handle all of the demand that's there.
Mr. President, how about at Guelph?
Well, I think those are great points. One of the things that we're looking at along the health promotion line is around resiliency. And thinking about prevention, education, programming, developing resiliency programs for students to attend in addition to the regular resiliency program within the classroom curriculum. And this includes actually these short resiliency building sessions, and they're done at key times, three times per semester, and we align them with upcoming midterms, for example, and exams. And they're really just reminders, they're cues, and they're kind of mental health literacy sessions so that people are a little bit more prepared during these the ebbs and flows of stressful timelines within the semester. So, but I agree. I mean, I think what we all struggle with in universities is our core business is education and research. But in order to fully support that mandate and for us all to be the best that we can be in that regard and to give students all they need to be successful, we need to provide a level of services to allow them, to enable them.
You need to, but are you able to?
Well, I think part of it is understanding and picking your spots, because the other piece to it is we use the word students, but of course students, that's one facet of who they are. They're also other parts of their lives. They're partners, they're family members. And so we need to also take an integrated approach and connect certainly our services within a broader context, and understanding that sometimes some of the pressures and stressors may not be specifically academically related, and how do they dovetail with the broader context.
Stephanie, I know that the amount of praying tends to go up around exam time. Does the amount of anxiety also go up around exam time?
Definitely. We see that students have multiple exams maybe in the same day, in the same week, and it becomes very stressful on students, especially around this time when they are trying to do their best to get the best grades in their courses, to move on to graduate school. But yes, definitely a very stressful time for all students.
What would you say to people who are watching this and thinking to themselves, back in my day, we didn't worry about this crap. Why don't you millennials just toughen up? What's the response to that?
Right. It's definitely a changing time. I think universities, as we mentioned before, are becoming more stressful in terms of you may not even be able to find a job with just an undergraduate degree as you used to be able to. You may have to go on to graduate school. You do have to care a little bit more about your grades, and when you have more classmates and you're all competing sometimes against each other, you have to focus on that A+ average that you need to get into some of these graduate programs in order to land those jobs after graduation. So it's definitely a changing landscape than when, say, my parents went off to college or university.
Heather Stewart, what's the response to people who might say, toughen up, you snowflakes?
Well, I think that they have to understand that people have always had these kinds of issues, and that it's starting to come out more. People are coming out of the shadows, as we like to say. And it's not a bad thing. We need to have help. We need to get it to these folks early so that it doesn't destroy their whole, personal trajectory. And just because we didn't do it 15, 20 years ago doesn't mean that it's not an important thing to do now. I think we've become a lot more knowledgeable and a lot more sensible about how we need to deal with mental health issues. And we have a very accessible population of young people. Why wouldn't we want to intervene if we can to help them live more productive and fruitful lives?
But if they have, let me do a follow-up with you, Dr. Stewart. If the demand for your services cannot be met, do I presume that you are having to transfer more and more students off campus to get service off campus?
It really depends on the university whether that's possible to do or not. Some universities do that entirely. It also depends on whether you're in an underserviced area. So we are, and believe it or not, in Kingston and surrounds, in an underserviced area. So our community resources are quite thinly stretched as well. And so, we have to start thinking about out-of-the-box solutions, which could include things like technological solutions, online support services, e-health, e-technologies. We haven't really explored a lot of these things as much as we could, and we do have emerging research showing that they are effective in dealing with a lot of these issues. So I think we need to just realize that we've got to be a bit smarter, leaner, I guess, in the way that we approach these kinds of issues.
Stephanie, how about, you're on the campus of one of the great medical schools in the world. But I wonder whether even MAC can keep up with the demand for mental health services. We hear from our Student Wellness Center that it is very hard to keep up with the demand. When we're hiring more counselors, they often are filled up, their times are filled up very quickly as well. And we do see a lot of referrals off of campus, which I think is important as well. Universities will never be able to service all of the mental health needs of students, especially more complex and specialized needs, such as maybe eating disorders, for instance. I don't know if our campus will ever be able to fully support someone with an eating disorder while they're going to university, and it's very important that the surrounding communities also receive enough resources in order to support those students and the full-time residents in the cities. How much referring to the town does the University of Guelph have to do if the gown can't keep up?
Well, I mean, I think that the coordination is the key point. It's not about either or, are we providing the services, or is the broader community providing? And I think there's a complementarity there and a coordination that needs to happen. In fact, we'll be working with the Guelph General Hospital in the months and year ahead to develop, to look at our role in an interdisciplinary health team kind of approach that includes the university as one of the partners, so that we have a coordinated understanding of where and how to provide the services.
Heather Stewart, let's, in our remaining moments here, just think about what more, if possible, you think universities could be doing to meet the increasing need for mental health services. Is there something that campus is now not doing that you think it ought to be or could be doing?
Yeah, there is something I think that stands out in my mind. A student and I just did a review of what universities and post-secondary students are doing across the country. And one of the big things we noticed that's lacking is a comprehensive and coordinated approach. Campus-wide. So what we see is a lot of different people doing a lot of different things. So the library is doing one thing, wellness services doing something else. The students have trouble sometimes figuring out where things are, what's going on. There's no single place where they can go that helps them understand what's out there for them. And at times it's possible that organizations or subgroups within the organization might be working at odds or duplicating services. So I think the big thing that we need to think about doing is really taking stock of how we're going to go about this in a very coordinated, comprehensive way, and then really figure out where the main gaps are. And I think universities are starting down this road now, as post-secondary institutions in general. But, even at Queens, we're just starting with our big wellness committee, getting together, trying to figure out what are the big issues, how can we address them, where are the big holes, how can we, use everybody to their optimum to make sure that we're filling these holes as best we can.
How about at the University of Guelph? What could or should you be doing?
Well, I want to reinforce the point of taking a broad, coordinated approach. National mental health standards. Each university, of course, will work in their own context and develop solutions and approaches, but they need to speak to the same fundamental standards and principles, so that students understand why we have the services that we do, and they connect those services with some more high-level understanding of the standards that we're working with. And I think that this is something that we're working. I know that Heather's involved in that as well, and Bell Let's Talk has been key, along with the Mental Health Commission. I think that's going to be a huge help, because it'll give us kind of a songbook or a playbook, if you will, from which to develop these our individual approaches to services. And I just want to reinforce the technology piece. If you look at our field, and you look at how we were delivering mental health care in the 60s and 70s, how we're delivering it today, you're beginning to see a change. But for the most part, we're still using the same tools. Students expect more counselors and psychotherapists and the traditional approach. But I think that both the capacity issue and the nuances of what's required are going to call on technology. We have to be smarter with technology. We have to incorporate technology, partly for capacity issues, but also because I think that there are very nuanced things that we can address with technology that are actually far more effectively addressed than one-to-one.
Let me give you the last word, Stephanie. Anything MAC not doing now that you think they could or should be doing?
For sure. I do believe the coordination is very important between the university and the community as well. And definitely making sure that the support we're offering services all students. Students do have very, very diverse needs. Identity does play a lot into students' experience interacting with mental health services, and making sure that we do have counselors from diverse backgrounds, and we do offer culturally diverse supports to students, just to ensure that they're receiving the support that helps them the most.
What are you taking at MAC?
I'm taking the Arts and Science program.
Fantastic. How many years?
It's a 4-year program. So
and you're in year what?
4.
Convocation time.
Yes, indeed.
How old are you?
22.
I got to tell you, you did a superb job today.
Oh, thank you.
You got a heck of a lot of poise being out here with these heavy hitters, so well done. Can I thank Heather Stewart at Queen's University in Kingston, Stephanie Bertolo, the Undergraduate Student Alliance Steering Committee member at McMaster, and Franco Vaccarino, who is the President, Vice Chancellor at the University of Guelph. Great to have all three of you on TVO tonight. Thanks so much.
Thank you so much.
Thank you.
Terrific.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.